All right, today I'm going to demonstrate for you how to place an NG tube. So the first thing we're going to do is review the client's medical record and verify there's an order, and I see that there is. So next we're going to gather our supplies. Once we've got all our supplies gathered, we are ready to go to the patient's room. So first thing we're going to do is wash our hands. And then we're going to knock on the patient's door. Hi, this is Linda, your nurse. I am just coming in to check on you. And it looks like your doctor has written an order for an NG tube to be placed. So the NG tube is just a tube that will slide down your nose. It goes down into your stomach. And we'll hook that up to suction on the wall, and that will help suck out the content in your stomach that's not able to pass. This should help a whole lot with your nausea and vomiting, and it'll also help with that pain you've been having. Can you just verify that I have the correct patient? Can you tell me your first and last name and date of birth? And I will verify that against the medical record, and it matches. So I'm going to provide for privacy. I'll shut the door to the room and possibly shut the curtains if necessary. Next, I'm going to get the bed in the proper position. So I'm going to raise the bed up to a good working height. I'm going to put the side rail down on my side of the bed and make sure it's up on the opposite side. And then I'm going to position the patient in a high Fowler's position, so at least a 45-degree angle. And I can add additional pillows behind her if needed. All right. I'm going to make sure she has some facial tissues within reach. And I've got a towel that I'll put over her chest, and I will do that after I measure the tubing. So if we're ready to begin, then we'll go ahead and wash our hands again. And we will put on some gloves. Okay, Mrs. Harper, I'm just going to look in your nostrils and have you take some breaths and see which nostril we should go down. So I'm going to plug this side, and can you take a sniff in for me? Okay, and then I'll plug this other side, sniff in. Okay, can you tell me which side you feel like you breathe better out of? This side? Okay, so I'm going to go into this side through this nostril. Okay. Next thing I'm going to do is have her blow her nose. So go ahead and blow everything out of your nostrils for me. Okay, good, thank you. Next, we will open up our Salem sump tube. And we're going to take this out. Okay, so I just need to measure this to make sure that I know how far I need to go in. So I need to measure under your gown, so I'm just going to lift your gown up here for just a minute, and then I'll put it back down again. So I'm going to measure from the tip of the nose to the earlobe, and then down to the xiphoid process. And I'm going to mark this place using a piece of tape. So we'll go ahead and put a piece of tape there where I was holding. Okay, now we can put this gown back down, and then I'm going to put a towel over your chest as well. Okay. Just in case we make a mess. All right. So now we are ready to start inserting. Before we insert, we are going to dip the tube in our lubricant. All right, Mrs. Harper, I'm going to put this in your nose. When you feel it in the back of your throat, please let me know so I can look in your mouth and make sure it's going in the right place. And then I'm going to have you tip your chin down to your chest and take some swallows of water. Okay, that's going to help the tube go down easier. In fact, let me give you a swallow of water before we start. Okay, you feel like you're swallowing okay? All right, so I'll just advance the tube with swallows once we get to that point. So I'm going to go ahead and put this in. Just let me know when you feel it in the back of your throat. Okay, you feel it there? So go ahead and open your mouth and I'll just look and I can see the tube back there. So that's good. Okay, so now I'm going to have you tip your head forward. So chin to chest. And I'm going to give you this cup of water here. So every time I say swallow, take a swallow and I'll push the tube down, okay? So go ahead and swallow, 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 and swallow. Okay, good. The tube is down. Are you having any difficulty breathing at all? You can put your head back up. If you're having any difficulty breathing, I would remove the tube. I'm just going to use that tape to hold it in place temporarily. And then if I were to have trouble getting that tube down, I would aim it downwards and toward the ear on the side that I'm going in. Okay, now we're ready to check placement. So we want to take our syringe and we're going to put 30 milliliters of air. We can remove this connector piece temporarily. Don't lose it. And we'll plug our syringe in here. Then I'm going to get my stethoscope. Okay. I'm going to listen to the upper left quadrant of the abdomen underneath the gown. So I'm going to put that there. And then I'm going to push the air in really fast and I should be able to hear a gurgle swoosh sound. So there, I heard the sound. So that's a good sign. That's one way to tell we are possibly in the right place. But just to be sure, we're going to check the pH as well. So I'm going to draw back 10 milliliters of gastric content. I'd say that's about 10. Then I'm going to take this syringe out. Now, once I lay this down, gastric content will go everywhere. So I'm going to just leave this kind of aimed upright on the towel. Okay. So then I'm going to take this fluid that I drew out and I'm going to put it into this cup, the little medicine cup. And I will use a pH strip to test it. So we just dip that in there for a couple seconds. And then we can compare against our chart here. So it looks like it is a 4, which is good. Less than 5 means we're in the stomach. So we are safe to assume we're in the right place. We would also obtain an X-ray to verify, depending on our facility's policies. Okay, so now let's put a better piece of tape or a securement device to hold that tube in place. So I rip off a piece of tape. I'm going to rip lengthwise. If I can get it to rip. Okay. So we'll just go down a little ways like that. Okay. We're going to take this piece of tape off, but make sure we don't pull our tube out in the process. Okay. Our new tape is going to secure. It's going to go on top of the nose, kind of over the bridge of the nose there. and then it's going to wrap around the tube like this. And then the next piece will also wrap around the tube, just like that. Okay, so that's being held secure. Now I want to connect it to my section, or my section tubing. So I want the connector, and I'm just going to place that in here. And then the end of that is going to connect into my connection tubing there. Okay. And then we will turn on the section. So we want it to, I think our order says low intermittent. So I'm going to flip that switch to intermittent, and I'm going to turn this up to that low area somewhere in that green range. Okay. Are you feeling okay, Mrs. Harper? All right, this should really help. So next I'm going to take the towel off, and we're going to just ensure that her tube doesn't get pulled by attaching it to her gown. For this, we will use a rubber band and a safety pin. So the rubber band, we're going to grab this tubing here, and we're going to loop the rubber band around it and then tuck it under itself and pull it through. See, so then it attaches there. And then we will take our safety pin and loop it through that rubber band, and we will attach it to her gown. Oops. So just like that. And then, Mrs. Harper, I just want to let you know this tube can easily be pulled. So be really careful when you're rolling over or changing positions. Make sure you take note of where that tube is. We want to make sure this is loose enough that it's not pulling. So yeah, just be really careful, because that tube could get pulled out if you end up rolling over on it or anything. So just be cautious that way. Okay, so is there anything else I can do for you right now? If you need, you can blow your nose a little. We'll just make sure you're cleaned up there. If you'd like, we could do some oral care. I could brush your teeth real quick for you. I'll let you take a sip of water and then spit. Okay. So I'm going to go ahead and put your bed back down to a safe level. I'll make sure the side rails are up on both sides. We can go ahead and recline you to a comfortable level. You're usually better not to be supine with this, so I would just tip your head back a little bit. Just recline your bed a little bit. And then if there's nothing else I can do for you right now or get for you, then I will check back with you shortly and make sure you're doing okay. So call me if you need anything or if you have any questions or concerns. So I'm going to go ahead and clean up my mess, gather my supplies that are lying around, throw away my garbage, make sure that her room area is clean. Then I'm going to go ahead and take off my gloves, and I will wash my hands. And then I can leave the room, or I can chart in the room. And I want to chart the reason the tube was inserted, the type of tube inserted, the type of section and pressure setting, color, consistency, odor, and amount of aspirate and drainage, the client's tolerance to the procedure, the effectiveness of the intervention. It's 2 days later, and I see there is an order to remove the NG tube. So I'm going to gather my equipment. So that will be my waterproof pad or a towel, clean gloves, toothpaste, toothbrush, a washcloth, and I'll make sure I have a trash bag nearby. I'm going to get ready to go into the patient's room, so I'm going to wash my hands. Knock on the door. Hi, Mrs. Harper. This is Linda, your nurse. It looks like the doctor wrote an order for us to remove that NG tube. It sounds like you're doing a lot better. I'm so glad. Can you just verify your name and date of birth for me? And I will verify that against the medical record, and it matches. So I'm going to provide for privacy, and I'll close the room door or the curtains. So to remove this tube, I'm just going to have you take a deep breath, and I will just pull it out. It comes out real easily. So I'm going to go ahead and raise the bed up to a comfortable level and make sure you're on a 45-degree angle. I'll put the side rail down on my side of the bed, make sure it's up on the other side. I'm going to go ahead and put my gloves on. If I can get them on. Okay. I'm going to go ahead and unsafety pin the tube so that I can put a towel or a waterproof pad across your chest there. Okay. And then we're going to turn off the suction, so we'll flip that switch to off, and we can disconnect the tube. All right, I'm going to clamp that so it doesn't leak. All right, so I'm going to loosen this tape here. Okay, so on the count of 3, Mrs. Harper, I'm going to have you take a deep breath and hold it while I pull this out. All right, 1, 2, 3. Deep breath, hold it, hold it, hold it, hold it, hold it, hold it. All right, good. And we can just wrap this in that towel and throw the tubing away. Okay, I'm going to have you go ahead and blow your nose. We'll just wipe all that off of you there. Would you like some oral care? We can brush your teeth for you here. Brush your teeth, take a sip, spit. Okay, good. How are you feeling? Better? All right, well, I'm going to go ahead and put your bed into a lower position. You can adjust your height however you want it. You can lay yourself back further if you'd like. I'm going to put the side rails up, make sure the call light's within reach. Is there anything else I can do for you right now while I'm in here? If not, I will check on you again shortly, and let me know if you start having any kind of nausea or any problems like that. But I think you'll be doing great. So, thank you. I will check on you shortly. So, remove our gloves, wash our hands again, and then we're going to document, and we're just going to document that we removed the tube and how the client tolerated it.